I just got laid off. I was laid off from my outpatient job and I was working in a NICU follow-up clinic. I have never experienced something like this before. So I'm doing what any sane person would do, which is I'm eating French fries, waiting to go into Hobby Lobby. I will say I'm very thankful that I work per diem. I do have a second job that I'll just pick up a little bit more at. I don't have benefits through this job, so I'm not taking a hit as much as a lot of the other nurses are, but whoa. I have a lot of feelings about this. I think the biggest one I'm feeling though is disappointment and I'm a little bit angry. This is the first time where I have seen with my own eyes that we treat healthcare like a business. It sucks because at the end of the day, the people who are suffering this layoff the most isn't me, it's not the nurses, although yes, we are suffering, it's the kids. And that's what I'm having such a hard time understanding is, why are we doing this when we know the detrimental impact it's going to have on the patients who are the children?
Hi, welcome back to the channel. Thank you so much for stopping by. I never knew a day would come where I would see with my own two eyes working in the healthcare industry getting laid off. And it was so surprising to me because what you mean that a doctor is getting laid off and nurses are getting laid off? It was kind of weird to me because a lot of people go into the healthcare industry thinking like that's supposed to be like a recession proof where you kind of feel secured and you know definitely you're not going to lose your job. Even when people are going through like very tough times, people are getting laid off, that's the job that you know for sure nothing is going to happen to you and people are jumping into it, especially a lot of people who are going through this unemployment phase where it's like there's no job, people are struggling for jobs, some are going back to school to go and join the healthcare, and you're telling me that that's industry that is already starting to face layoffs. That's so shocking to a lot of people. So we're going to be checking out this video and hear those who were laid off and hear what they have to say and what they experienced. But before we get right into this video, I want to give a very big shout out to Sean. Thank you so much for sending me a $5 cash app. I appreciate you for always supporting the channel. Please make sure you click the like button, it helps with the algorithm, and I appreciate that so much. Let's get right into this video.
So since my last post about being let go as a doctor, I've been getting a lot of DMs, phone calls about how other doctors or people they know have been let go. A doctor at UCSF and their department having a 3-month wait, they were let go, along with another one of their colleagues. And another per diem doctor was also let go. And it's thousands of VA, like Veteran Affairs doctors and nurses were also let go. So yeah, it's not just me, and I know that. But yeah, yesterday I just felt like the rug was pulled out from under me, and you can see that I'm still in scrubs, so I'm still going to work, which is really strange to me. And I'm gonna be here until the end of the month. So I'm just feeling like if this is happening to me with all of the privileges that I have, like I'm educated, I am able-bodied passing, then, and just, yeah, sorry, people are like walking by. So yeah, like with the privileges that I feel like I do have, and you know, like also losing my job, I'm just thinking about everyone else who is like negatively impacted by this administration. So I know people are meaning well with like recommending me to get like full-time jobs, or like getting another job is going to be easy and yada yada yada, but that's not what I'm worried about. I'm worried about our collective future. Yeah, that's what I'm worried about. I'm worried about what's going to happen to people further in the margins. Like, it's probably happening now, which is what I'm hearing from some of my patients. So yeah, that is what I'm worried about. I'm worried about our collective future. I am worried about my future, but I'm more worried about our collective future. So if people have been asking me how to support me, I think it's by speaking up. I think that's going to be the most impactful, because I do believe that whatever we say, it's a ripple out from everyone individually. And one of my friends did tell me before that, hey, all these conversations that I was having with my parents, who, you know, are MAGA, unfortunately, she said, hey, that is also activism. And that really opened up my mind about what activism can look like. And so yeah, I think just talking to people who, if you have capacity, that would be supportive, and that would be supportive for me and like for everyone who's going to be impacted by this administration or the people who are already impacted. So yeah, thank you.
I'm going to go to work with a pretty heavy heart today because 52% of my Foundation Year 2 doctors who have finished Foundation 2 year yesterday, I know that they're just unemployed. They're going to be driving taxis, Uber Eats, working in Aldi or whatever. And the other 48% that are going to be joining me, I know that a lot of them have finished work yesterday at 12 o'clock and then expected to go home, pack up, move to another hospital, maybe 4 hours away, maybe 5 hours away, if they're lucky, a couple of hours away, and come on a shift at 8 o'clock in the morning. I'm going to support them as best as I can and try and give them as much reprieve as I can, to be honest. But yeah, I mean, it's not like this just happened. This was years in the making. And we have to deal with it. And you as patients have to deal with it. How is that fair? It isn't really, is it?
Y'all know this, but they have been cutting a lot of doctors. I just seen a video and I had to go Google this. They are cutting doctors. Okay, like people are working until the end of the month, and then after that they don't have a job, or of course they have to go find a job as a doctor. You mean to tell me that this world is want money so bad for all this other stuff that's really not important, to where you're gonna cut doctors? I read it and it's pretty much said they're cutting doctors, especially at the VA. It said the VA has a 95% low rate on having doctors. It's lower than normal, 95%. Okay, that when it comes time to set appointments, that your appointments can be booked out for months and months. Like, this is August. You couldn't probably see a doctor until like November, right? So I don't think people are paying attention to what's going on. If we don't have doctors, what are we doing? This is nuts. This is insane. And I try to like read the news and pay attention, and somehow I miss that. But cutting doctors and people in the medical field, people who went to school for years, is crazy to me. This is horrible across everything. But as I always say, this is what some people voted for, so I don't even know.
I thought nursing in America had the greatest job security. Turns out I was wrong. A new hire who was training with us today actually told me she was laid off from Providence, along with multiple other nurses and a couple pharmacists back in July. And what's wild to me is this is not the first story of layoffs I've heard happening in healthcare. It seems to be happening all over the country. And I'm really curious to know, why is this happening?
A lot of people think that working in healthcare is super secure and super safe, but working in healthcare is probably one of the more risky things you can do. Let us go through the list, okay? If you want to work in healthcare, that means you need to go to school and pick up a lot of student debt, okay? So yes, debt there is risk. If you work in healthcare, people think it's very secure. You always have a job because obviously people need a lot of health, like they need to take care of their health, right? Then why are companies laying off a bunch of healthcare workers right now? I mean, just look up the news or you can check out some of my videos. So there is now the risk of layoffs. Now let's talk about the third thing. People think like, oh, healthcare, there's going to be a lot of meaning when you're working in healthcare. You get to help people and that. Then why are doctors, nurses, therapists, so stressed all the time, so exhausted, so burnt out all the time? The emotional, mental, physical toll on a healthcare worker is extremely, extremely high. So you're running the risk of kind of like losing your soul, losing yourself working for this job. So the risk of working healthcare is really, really high. But the problem is that when you are starting to work in healthcare or you dream of working in healthcare, working in this field sounds like, oh my goodness, what a great thing to do, right? Like everything's going to be great. I need to do everything I can, take on as much debt as I can, work as hard as I can to get into the field. But now that I'm a few years into it, I'm seeing all the risk and nobody talks about this, at least until you're like many years into it and then you start seeing the signs, right? I promise you, all senior people who work in healthcare, they feel the same way. But a lot of us feel trapped. It is risky to work in healthcare. It is not safe. And that risk, again, is fine. If it's something that you're passionate about, please go on ahead. But I'm here to tell you that you can be super passionate about something, but it doesn't mean that it's something you want to do for the rest of your life. I was very excited to work in healthcare early in my career for a little bit, for the first few years. But as I'm starting to see that, there's not much potential for growth, that, all these ideas I have and all these like experiments I want to do to improve things aren't really accepted, I'm starting to get more and more burnt out and more frustrated. And I don't want to stay in this field if that's how I'm feeling. Everybody only has one life. And if you have that one life, you need to think about how to use it. I know you want to help people, and some healthcare workers feel guilty, like, my purpose is to help people, I can't leave healthcare. But you can help people in so many different ways. People have so many problems, not just health problems. Figure out how you can use your expertise to help them. It can still be healthcare related, but maybe you can do it your own way.
Children's Hospital Los Angeles just laid off 437 employees. That includes bedside staff, therapists, case managers, and other non-clinical roles across almost every department. The layoffs go into effect October 28th, and CHLA says staff will still receive pay, benefits, and severance in the meantime. But here's what's not being said directly. CHLA leadership blamed growing financial challenges, but didn't exactly specify what those challenges are. And so here's the context. Their Sabin Research Institute is among the top 10 pediatric research centers funded by the NIH. But since Trump was reelected, NIH budgets have faced serious political pressure. At the same time, this administration also signed the One Big Beautiful Bill Act on July 4th, which includes hundreds of billions of dollars in Medicaid cuts. A pediatric critical care physician who wrote in Stat News already warned that this law could devastate children's hospitals. CHLA hasn't confirmed if that's the reason behind these layoffs, but the timeline and impact speak volumes. So they have now frozen hiring, canceled job openings, and started cutting back on hospital supply purchases. And yet they're still telling the public children continue to need the specialized care only CHLA can provide. But let's be clear, you can't cut that many positions, 450, and still promise the same level of care. Not for NICU babies, not for kids in oncology, not for children recovering from surgery. So this is one of the most elite pediatric hospitals on the West Coast. And even they are not protected from what's happening nationwide. It's Medicaid, it's research funding, it's broken reimbursement. And above everything else, it's the kids and the frontline staff who keep getting left behind. So yesterday I received a flood of DMs from CHLA staff, past and present, and what they're describing is very disturbing, and I want to bring this to you. So veteran employees were offered retirement packages, and if they declined, they had to sign away all future raises. The surgical admitting department has been completely dissolved, and leadership told staff that the hospital has a $60 million deficit, mostly due to Medicaid cuts, and CHLA's patient population is over 75% Medicaid, just like many children's hospitals across the country. But here's the contradiction. While permanent staff are being laid off, travel and locum contracts are still active. Leadership has even said that travel nurses are cheaper. That's the priority. Multiple people have told me firsthand that CHLA cut nurse managers and educators during COVID, and now they're pushing RNs into salaried supervisor roles, more responsibility, but no overtime. So if you say no, you're gone. One former staffer shared they tried to transfer departments, but a sudden hiring freeze blocked it. And after they left, CHLA called, asked if they still wanted the job, but that the whole department is now dismantled. I received another message that described how leadership offloaded billing issues onto staff. So instead of addressing coverage or authorizations up front, workers were told to see if the department can eat the costs. So even when red flags were raised, leadership said, just push through it and we'll fix it later. I did receive several messages that confirmed that employees received layoff letters and are being forced to reapply for their own jobs. They're expected to keep working through October until leadership decides who stays. 2 months ago, staff were told that there would be no clinical layoffs. Now they've brought in a third-party firm and people are being picked off department by department. And yes, CHLA is reportedly under FBI investigation after pressure from Trump and his allies who claim the hospital's gender-affirming care program is mutilating children. So this is a lot, and this is what frontline healthcare looks like in 2025. We have scandal, we have lies, we have political interference, and a system that keeps punishing the people, the actual people that's doing the hard work. They deserve better, and I'll keep making sure that they're heard.
It seems like everybody's getting a hit this time around because just like with the tech industry a few years back, all you'll be hearing is, oh my god, like come with me as I go, like as I work in my tech job, as I work my tech job and this and that. And it's like people are always like, oh, you better go into tech because it's always going to be in demand. Oh, you better go get a degree because it's always going to be in demand. And it's like there's just so many things like that were pushed, and then all of a sudden you see this and it's making you question like what's happening. Like it's crazy. Now a lot of these places that were supposed to be secure, like, people always need medical care. People are always going to need it. It's not something that is like, oh, maybe it's not going to work out. It's always going to be in demand. But it's like now these healthcare industries are making cuts and this is happening to people. They're laying off people. It's sad. It's crazy because really like an industry that we weren't expecting this to happen. So I was shocked when I heard this doctor talking about she was laid off. Like, what? Like a doctor being laid off, mostly for tech people who were really like, you know, the ones who were going to tech, you're not gonna lose a job. And then it's like, damn, like the moment the economy just started becoming something else, they are the first people like out. All like whenever I turn around, tech layoffs, and it's like so much. The mass layoffs is just too much. It kind of makes you start questioning like what is the next thing, like what is even the secure thing? Is there really any secure job out there? Because the thing is, in this healthcare industry, I have seen a lot of people voluntarily actually quitting their jobs. Like they're leaving the field on their own. Like nobody's even forcing them. Some of them not even laid off, nothing like that. They just choose to leave because they have like so many things and takes that they have in that industry. They're like, a lot is going on and they're not interested in it. They feel like they don't, all they really care about is just money, and they don't really care about people's health. And so most people are just choosing that, or either they are stressed. There's just so many reasons for why people are voluntarily like leaving those fields. You've made it to the end of this video. Thank you so much for watching this video to the very end. Please make sure you click the like button and subscribe to the channel if you're new here and you're watching me for the very first time. And hit the notification bell to get notified every time I post a new video. I will see you on the next one. Bye.